The eye, one of the most overused and overlooked organs in the human body. We use our eyes every single day, and yet most people just think, gosh, I wish I had blue eyes. Rarely people stop to think about how their eyes work, let alone research the subject. And usually, when people stop and think, they get grossed out. But I don't. Hello, my name is Seth Wilder, and I'm studying ophthalmology this year in ISM. What I would like to do now is have everyone who's paying attention close your eyes and look up toward the screen. So just close your eyes, look up toward the screen, and don't look. I'm going to change the slide, but I don't want you to look. All right, open your eyes. Can anybody tell me what they saw? Or what? No, tell me what you saw. Like, can anyone tell me what you saw? Just black, right? Can anyone tell me what they saw on the screen? Well, the screen was black too. Now, this is what blind people see every single day. And this is why I am studying ophthalmology. I would like to help the blind people and help them with their vision as much as I possibly can. I also would like to help prevent people from becoming blind as much as possible. This is really why I want to do ophthalmology. And the quote that's helping me get there is this: your work is going to fulfill a large part of your life, and the only way to truly be satisfied is to do what you believe is great work. And the only way to do great work is to love what you do. If you haven't found it yet, keep looking. Don't settle. As with all matters of the heart, you'll know when you find it. Now, this is a quote by Steve Jobs. I know I'm not into tech, but this quote really drives my work, because if I begin to not like ophthalmology, I know I can always just stop anytime I want, because this is just the beginning. I'm not even close to picking my major or anything else. I still have a whole nother year of ISM to figure out if I want to continue doing ophthalmology or not. I actually started out wanting to be a lawyer. When I first came in, when I was interviewing by Coach Goff, I said, yeah, I would like to be a lawyer. But that actually changed during the summertime when I went to visit my dad's ophthalmologist, and he kind of talked me into becoming or wanting to do this. Yeah. So that's the quote that helps to drive my research every single day, and it just drives my research. I do it every day, and I think about how much I love it, and no matter what I'm working on, whether it's glaucoma, cataracts, eye surgery, eye plastic surgery, I'm always thinking about how much I love ophthalmology, and it's always driving me. So good traits to have when you're an ophthalmologist. Obviously, a good tolerance for blood. That's all. It's like any doctor, you have to have a good tolerance for blood. If you can't see blood, you're probably not going to be able to do any surgery. You have to be coordinated with your hands, especially with the eye. If you do any slight slip up with any eye surgery, you're probably going to end up permanently blinding anybody, which is the exact opposite of what you would like to do. You have to be good under pressure. There's always extreme pressure, even if it's just cosmetic, or if it's just, or if it's an emergency situation. The eye is extremely delicate, and you have to be very good under pressure. You have to be thorough. You have to be thorough, because even if you are really slow and really meticulous and really good, you're not going to be seeing as many patients, and you're not going to be helping as many people, and also you're not going to be making as much money as you can. You have to like helping people. One of my interviews was telling me about how he said he knows a lot of ophthalmologists who don't like people, and they hate their job for it. So if you don't like people and you don't like helping people, you're not going to be able to do this job. You have to have, obviously, medical knowledge, and you have to stay focused. This is a very driven career. You're like 12 years of school. You have to stay focused toward that end goal. You have to be calm. You have to be very calm. And you have to stay informed. You have to be up to date on all information. And this is because people come in all the time to clinic, and they're like, hey, I heard about this, this, and this to help cure my glaucoma disorder. And if you don't know what it is, the patient's going to be like, oh, this isn't a good doctor. I have to go switch my doctor because he doesn't know about this brand new surgery or this brand new pill. So you always have to stay informed as much as possible. For my interviews, my first interview, actually I had 5 interviews, but I did 1 phone interview, so I'm just going to count that on here. My first interview was with Jose Iglesias. He's actually a pediatric surgeon. He is not an ophthalmologist. And I did an interview with him because When I first started off ISM, again, I had switched what I wanted to do, and my dad wanted to make sure that I actually wanted to do ophthalmology. And so he said, hey, why don't you interview someone else who's not in the ophthalmology field? So I decided to email Dr. Jose Iglesias, who is a pediatric surgeon at Cook's Children's Hospital. And I drove about 30 minutes to go interview him at a Starbucks. And it was a very, very relaxed interview. It was very nice, very easygoing. And he helped me realize that there's so many options that I can do, and even though there are so many options, and as much as he enlightened me about pediatrics and how much I did enjoy listening to him talk, I do love ophthalmology more, and I did want to continue doing ophthalmology. My second interview was with Dr. Meza, who actually ended up I asked to become my mentor, and this was a very special interview because when I emailed him to ask him if they wanted to do an interview, he said, oh yeah, sure, just come on down and you can watch a surgery or two, and we'll do interviews like in between surgeries. And I was just shocked. I was like, oh, surgery, what? I haven't even gotten a mentor yet. I was like, this is crazy. What the heck? And I was very shocked. I was very nervous. But that's what we did. We went in and I watched 3 surgeries that day, and throughout all those surgeries, he was telling me what we was doing, and I realized I could actually handle surgery that day, and it was insanely helpful, and I couldn't thank him enough, and I loved him so much I just asked him to become my mentor a couple months later. My third interview was with Dr. Marie Sirkin, and this is the man and the gentleman who actually prompted me to do ophthalmology, because this is when I went in and he was telling me all about my dad's condition, and I just realized I liked it and I wanted to pursue this career. He's a retina specialist at a hospital close to Dallas. He's a very easygoing and relaxed kind of guy. Where he actually said, hey, come and we'll just email, or we'll just do this interview at my house. And I was like, oh, okay. And it was crazy. His house was very nice. And he actually told me, you can't just be an ophthalmologist. You have to be able to do many things. You have to be able to invest. And he taught me a lot about just life and doing more than what you have to do and putting out the extra effort. My fourth interview was a phone interview with Dr. Jess Whitestein, and he actually taught me a lot about glaucoma, and he actually prompted a lot of my research on glaucoma, because he's a glaucoma specialist, and even though it was over the phone, it was still very insightful, and I appreciated the interview. And my fifth interview was with Gary Pasik, who actually works with Jess Weinstein, and he is one of the head departments at UT Dallas. And this interview was very insightful because during the interview, I actually couldn't find him at first, and when I found him, he was like, "Oh, it's okay." And he was also another one of those very easygoing guys, and he took me around the area and showed me around what he does, and it was very helpful. Then we went and we did the interview, but it was also another one of those where I was hard pressed. I couldn't decide who to choose to be my mentor, but in the end, I chose Dr. Mazo. But he was one of those top choices. And my fourth interview was Dr. Chan Nijin, and this was my final interview, and I learned a lot. That she was very, very passionate about her work, and in order to be an ophthalmologist, you have to be passionate about your work no matter what. She's a cataract specialist, and I also learned that my questions for my interviews, they were actually very brief, and I realized that I should have had deeper questions because of her, and that's what I'm going to do next year. I'm going to make sure my questions are actually very, very insightful, and it was very helpful to me. Now, my mentor, Dr. Mazo is my mentor, and some of the procedures he does, but not limited to anophthalmosis, blepharopathies, blepharospasms, congenital brow lifts, and dry eye and ptosis. Those are just 7 of the 16 different surgeries he does, and I've actually seen, I believe, all of those different surgeries, and it's just an insane experience, and I just couldn't thank him enough for it. He operates on Monday, Wednesdays, and Fridays, and he does clinic hours on Tuesdays and Thursdays, and he has his own little section of his office, which is also very nice, and his big corner section, and we talk a lot in that office about my final product, and we also talked about my original work. And I usually visit him every Friday at a surgery center to go see his surgeries. And there's usually about 4 or 5, but usually we don't get through all of them because of time constrictions. Now, this is also a video of what Dr. Mazow does. Not going to show it because it's a little graphic to some audience, but I mean, that's basically what he does. That's I believe a blepharoplasty video where they're lifting the eyelid and they're just cutting. They first mark up the eyelid, they mark the eye right about here and then right about here, then they cut the skin along where you see the 2 incision marks, and then they cut down deeper into the eyelid and they hook one of their sutures in. They pull it tight, lift it up, and then they sew it back together. It's a very, very interesting process, and it's nothing like I've ever seen before. And I never knew. This also helped me realize that ophthalmology wasn't just everything in the eye. I realized that ophthalmology involves everything outside the eye, and it can be more than just the basic, look inside your eye and read these words on a wall, and it was just very insightful. So my research stems from a lot of my curiosity and a lot of what I learned during my mentor visits and my interviews. So I tried to do a lot of my research based on what my mentor does. And like I said, I did a lot of my research on glaucoma when I interviewed Dr. Whitestein. And I learned a lot. I learned that there's for certain aspects of the surgery, there are not a lot of cures that are the best for the eye, I guess you would say it. And there is a lot of room for creative improvement. I learned that you have to keep your eyes open. You got to be aware of other fields. A lot of the eye-related injuries, they lead into other injuries, and it just all kind of compounds onto each other. Because if you need a glaucoma specialist or a cataract specialist, you're probably going to need both of them together. Or even if you have contacts, that can lead to problems in your eyelid by raising the ocular pressure and things of that nature. And you also always have to stand out in your research. There's a lot of research that is also very basic and very broad, and you have to kind of stray away from that. You have to actually kind of dig deeper to find out the actual breadth of the ophthalmology field. So my original work, I wanted to see if there was any correlation between the amount of time someone spent wearing glasses or contacts and vision loss, which means like the time I spent looking at a computer screen or the time I spent looking at my phone or just the time I spend wearing my glasses in general. Does it have any relation to the amount to my sight? Does it affect my sight in any way whatsoever? And what I concluded was there is a slight variation. If you wear your glasses for me, I guess, I wear my glasses more. If I wear them more, my eyes will keep deteriorating. And this is also because when I was researching, I found out certain people, their eyes, they don't settle, I guess you would say, this is the best way to say it. They don't settle very fast. And some people's eyes, they come and they become accustomed to the one set of glasses and then they stop and then they don't deteriorate anymore. But for some reason, some people's eyes, they keep deteriorating over time, and you have to wait until they stop. So the best time to get glasses, I guess, would be when you don't, or not when you're very young. You have to wait a little bit and try to get them later on in life. But that's when people usually have glasses. People usually get glasses also when they're very young or they're very old. There's not a lot of in between, because your eyes also begin to deteriorate later on when you're closer to your 50s and your 60s. I also talked to Dr. Pasika about my work because his research or his profession was very closely integrated into mine, and he actually helped me come up with a couple of my solutions and a couple of my conclusions about my research. And he was very helpful, very key part in my original work and my findings. Yes. So for my research, that after my original work, I was very lost about what to do for my final product, and I wasn't exactly sure what I wanted to do. So I actually decided to go back through my past research, and I wanted to see if there was anything that I would like to bring back or come back because there was a lot of stuff that I did that I thought was very interesting, and I wanted to bring it back. So what I decided was, because I hadn't had a mentor by this point, and I wanted to go back. So I went back and I looked through a bunch of my old research assessments, and I found a couple of them, and I narrowed it down between two things, and what I ended up choosing was iris implant surgery. And if you don't know, the iris is what gives your eye its color. It's what gives your eyes color, but it's also much more than that. Your iris also dilates, and it brings in the amount of light that comes in. If you're standing too close to it or too far away from it, the iris dilates, and it actually allows you to see clearer and better. And what the iris implant surgery does is it places an artificial iris, such as the one on the very far bottom or the very top right. It places one of those irises on top of your actual iris, and this does tremendous amount of damage to your eye. If you look on the left, the very far bottom left, that is the result of removing one of those irises, because they put an adhesive on it that allows it to stick to your iris, and when you remove it, it just causes an extreme amount of damage. But this isn't because, I wanted to get it removed. No, they had to get this iris removed, because if you put an artificial iris on your eye, you will have problems, because anything you place inside of your eye, including contacts, there is a risk. And even any surgery you do, there's always a risk of complications after surgery. So what these patients, most of them had to do is they get their artificial iris in Panama or somewhere outside of the United States, because this procedure is not FDA approved. And so the people they go to, may not even be certified doctors. They say they're doctors on their website, but they're probably not even real doctors. They go in, not even to a hospital, not even a surgery center. It could just be someone's house, and they have this surgery done, and within 2-3 days their vision's a little blurry, because that's just regular stuff. But within 6 months to 2 years, their vision, they're going to have problems. They say there's a couple stories where the people have said they described their eyes, someone just kept stabbing them in the eye. That's how much pain they were in. And it's because part of this is because this iris blocks the trabecular meshwork in the eye, which allows the tears to be produced and allows the tear flow. And it blocks the dilation of your eye. So your eye isn't dilating, it's not getting as much, it's not getting the right amount of light into your eye. And this is very harmful, as you can see on the left and on the right, for your eye. And so these people, after 2 years, they come into their ophthalmologist, and they're like, "Oh my God, we need to check you for this and that." And they end up coming out with cataracts, glaucoma, congenital problems. They have iris problems. They have so many things that are wrong with them. I can't even name them all. And what they end up doing is they have to go through immediate surgery, and they go in, they have it removed. What they do is they make a 3-inch incision. The same way they have it, place it in, they make a 3 millimeter incision, not 3-inch incision, my bad. 3 millimeter incision into your iris, or into the white part of your eye, your sclera. They pull it out, or sometimes they cut it into 3 different pieces. While it's still on your eye, they cut it in half, and they remove it piece by piece, or as in this case, they just pulled it out all at once. But either way, it ends up really bad, because there's scarring everywhere, and it just ends up, it's so bad. But the patients, they do end up stabilizing sometimes, but their vision will never be the same. They're going to have problems. They're going to have to use glaucoma drops for the rest of their life. However, as bad as the surgery is, it's also approved in the U.S. for certain situations. For people who have aniridia, which is a condition involving the iris. It's a deformation of the iris, either at birth or from an injury. It's where part of your iris is actually missing. There's only a certain amount of doctors in the United States that can go in, and they can actually have one of these implanted onto your eye to make you look. It's for cosmetic and for obvious purposes, because they're not getting the amount of light in. They have it inserted into their eye, and it actually helps these people. These people actually, their vision does improve, and for these people, they take the drops and everything as prescribed, and there are not as many side effects as there are for people who just want it done for cosmetic reasons. So there is an upside, but there's not a lot of people with aniridia, and usually this iris is done through illegal times in other countries that do not involve the U.S. What the heck? Okay, so what I decided to do was I wanted to create an artificial iris that you could plant onto the eye and it would be safe. But what I realized is through my research, there's nothing that you can do that would allow you to put anything on top of the eye and be safe for the eye. So what I actually have to do is, or what I am doing, is I'm writing a paper about everything involved in this eye, everything I just said, and the doctors, the people you can go see to have this removed, the doctors that do the surgery. The one company that actually does this surgery, which is called New Color Iris or Bright Ocular, which is both because I keep switching their names because it's illegal and they're moving around. They're based out of New York, and I'm doing every research I possibly can on them and on this subject, and I'm trying to make a paper that will basically I will put out and I will show and I will describe all the things that is wrong with this surgery, the good parts about this surgery, the bad parts about this surgery, where you can have it done, why it's bad, and just anything you can think of I'm doing about this surgery. And as you can see, those are some of the times that it's helped people like the gentleman on the left. It helped with his problem, but the woman on the middle, she just did it for cosmetic purposes.
So is the middle, which one is before and after?
The one under it is before and the one on top is after. For the middle person, but then on the top it's before and then on the bottom it's after. So yes, that is my final product, and I'm very excited about it. I'm almost done with it, and I'm going to bring it to my mentor on Friday, and we're just going to go over it, make a final corrections, then we're going to turn it in, and it's going to be a huge success. And also, I meant to say, when I came up with this product, I was always thinking about people saying, hey, your eyes are so pretty and you have beautiful blue eyes, and that's what prompted this research in the first place, was because people kept saying my eyes and how they wanted blue eyes. And I was like, oh, is there a way to change eye color? And that's how I came up with this project that actually turned into being something very sad and something very helpful at the same time. In conclusion, after all this research, I feel like I have done so much when really this is just the tip of the iceberg. I feel like I have a head start in something that I enjoy spending time on, and for that I am truly grateful. Next year, I wish to pursue the ophthalmology field again and learn even more than I did this year.